When we're coming forward with information for the public and we're saying we want you to trust us, that means we have to check every box. And at this point, even if we're looking at these clinical trials, they exclude a lot of people, one of which is me. I'm a woman, and they're excluding women and pregnant women from those trials. A lot of the studies also excluded people with renal disease. They excluded people with cirrhosis. And unfortunately, in the United States, we have 100 million Americans with pre-existing conditions that have chronic kidney disease, that have chronic liver dysfunction, that have hypertension and heart failure. And so are we comparing apples to apples or apples to oranges and hoping that those two fruit mix?
I need to respond to that because it's completely irrelevant what she said. That applies, what she just described applies to every research study ever done known to man on any drug. All of those patients are always excluded until you have sufficient efficacy and safety data. So ivermectin ivermectin is not unique in that regard, and that should not be considered less than. The second thing is there's this immense amount of data showing a preventive. So it prevents transmission. And so we have a protocol where we prophylax patients, so high-risk patients and or those who just got exposed. So if you have a household member who falls ill, from numerous trials, if you put the household on ivermectin, very few actually contract the disease. So we have a protocol for prophylaxis, post-exposure prophylaxis for high-risk patients or healthcare workers, numerous trials showing that if you're on ivermectin, your chances of getting it actually approach zero. I mean, there's one trial from Argentina where they did 1,200 healthcare workers, 788 took ivermectin once a week, not one got sick. In the 400 that didn't take it, 58% got sick. So there's prophylactic data, and we have a protocol for that. There's also a whole other host of trials on early outpatient mild illness. Patients are getting better quickly. They're not going to the hospital. And so we have an early outpatient protocol there, which is daily, minimum of 2 days, maximum of 5, but stop when you feel better. Many patients are feeling better within 2 or 3 days, which means they need 2 or 3 doses. And then we have part of our Math Plus hospital protocol. We have a daily dose of ivermectin once a day for 5 days, and we're seeing remarkable recoveries. The patients are telling me, Doc, I took the pill in the morning, and by nighttime, my chest felt better, my fever went away, and the next day they feel better. I mean, it's truly a very, very potent medicine.
Yeah, I want Dr. Hilton to respond to that.
Yeah, again, I want a miracle drug, but I look at everything from a fine-tooth comb because I understand if I say it, my family will jump and want to do it. And so I want to make sure I do my due diligence. But in looking at who actually tested positive in that group in the Argentina study, the majority of persons that tested positive was 11%, I think, that tested positive in the control group. But 78% of those that are in the control group were women, which makes me think if those healthcare workers are women, do they tend to be the nurses then? And are they in close contact with that COVID-19? Like we know our nurses are, they are fantastic in their bedside manner. But is that the reason why they ended up contracting the disease?
Well, Doctor, so hold on. Let me suggest this maybe. So, Dr. Kory, she's saying that certain groups were not included in the trials. You're saying that the trials are showing benefits. Is the answer then the recommendation to just use the drug for those who are actually in the trials? Would you both agree to that?
That's not how medicine works. So first of all, she's overstating who's not in the trials. There's many, many, many different trials done. They're not always excluding those that she said. There's no reason to exclude anyone with liver disease or kidney disease. It's one of the safest medicines known to man. That's why it's on the WHO's list of essential medicines. It's been given 3.7 billion times. It has an unparalleled safety profile. So to have concerns of whether you can give it to patients with comorbidities makes zero sense. We have more history and knowledge of this drug in treating disease in medicine than almost any other. 3.7 billion doses. So to throw up concerns about this patient with this comorbidity and that patient, that's never been demonstrated in the 40 years we've been using it and in the billions of times that we've used it. So I don't understand that concern.
Okay,